Acetaminophen is one of the most widely used treatments for pain and fever in the United States. Ofirmev is the first and only intravenous formulation of acetaminophen available in the United States, and it's indicated for the management of mild to moderate pain, the management of moderate to severe pain with adjunctive opioid analgesics, and the reduction of fever. Acetaminophen is contraindicated in patients with severe hepatic impairment, severe active liver disease, or with known hypersensitivity to acetaminophen or to any of the excipients in the IV formulation. Ofirmev offers dosing flexibility when treating adults, adolescents, and children 2 years of age and older. This video will demonstrate how to dose and administer Ofirmev for adults, adolescents, and children 2 years of age and older, as well as review general dosing information. For adults and adolescents 13 years of age and older, weighing 50 kilograms or more, 110 pounds, the recommended dosage of Ofirmev is 1,000 milligrams every 6 hours, or 650 milligrams every 4 hours. The maximum total daily dose of acetaminophen by any route is 4,000 milligrams. To administer a 1,000 milligram dose, 100 milliliters of Ofirmev, after inspecting the vial, use aseptic technique. Remove the cap and insert a vented IV set through the septum of the vial. Open the vent, hang the vial using the attached loop, connect the IV line to the infusion pump, and administer to the patient as a 15-minute infusion. Set the flow rate on the pump to 400 milliliters per hour and set the volume to be infused to 100. Alternatively, the flow can be adjusted using a roller clamp and set to the desired infusion rate. For example, for 10 drops per ml tubing, 100 ml of Ofirmev should be delivered at a rate of 11 drops every 10 seconds for a 15-minute infusion. For all doses less than 1,000 milligrams, 100 milliliters, the appropriate dose must be withdrawn from the vial of Ofirmev and placed into an empty, sterile container before it's administered. To administer a 650 milligram dose of Ofirmev, after you have inspected the vial, use aseptic technique. Remove the cap and withdraw 65 milliliters, 650 milligrams, from an intact, sealed 100 milliliter vial of Ofirmev. Place the measured dose in an empty, sterile container, such as a glass bottle, plastic intravenous container, or syringe, for intravenous infusion. Do not add other medications to the Ofirmev solution. Label the new dosing container and discard the unused portion of solution left in the vial of Ofirmev. Connect the container holding the 650 milligram dose, 65 milliliters, to an IV line and administer as a 15-minute intravenous infusion. The infusion rate to administer a 650 milligram dose, 65 milliliters, over 15 minutes is 260 milliliters per hour, and the volume to be infused is 65 milliliters. Alternatively, the flow can be adjusted using a roller clamp and set to the desired infusion rate. For example, for 10 drops per ml tubing, 65 ml of Ofirmev should be delivered at a rate of 7 drops every 10 seconds for a 15-minute infusion. For adults and adolescents 13 years and older, weighing less than 50 kilograms, the recommended dosage of Ofirmev is 15 milligrams per kilogram every 6 hours, or 12.5 milligrams per kilogram every 4 hours, with a maximum single dose of 15 milligrams per kilogram up to 750 milligrams. The maximum total daily dose of acetaminophen by all routes is 75 milligrams per kilogram, up to 3,750 milligrams. For children 2 to 12 years of age, the recommended dosage of Ofirmev is 15 milligrams per kilogram every 6 hours, or 12.5 milligrams per kilogram every 4 hours. The maximum single dose of Ofirmev is 15 milligrams per kilogram, and the minimum dosing interval is 4 hours. The maximum total daily dose of acetaminophen, by all routes, should not exceed 75 milligrams per kilogram. Doses less than 100 milliliters should be withdrawn from the Ofirmev vial and placed into a separate sterile container prior to administration. The entire 100 milliliter vial, 1,000 milligrams, is not intended for use in patients weighing less than 50 kilograms. The effectiveness of Ofirmev for the treatment of acute pain and fever has not been studied in pediatric patients under 2 years old. Using aseptic technique, withdraw the appropriate dose, 650 milligrams or weight-based, from an intact sealed Ofirmev vial and place the measured dose in a separate, empty, sterile container for intravenous infusion. To administer small volume pediatric doses of Ofirmev, up to 60 milliliters in volume, place the volume into a syringe and administer as a 15-minute infusion using a syringe pump. Use the syringe pump as directed by the manufacturer. Remember, each milliliter of Ofirmev contains 10 milligrams of acetaminophen, so the appropriate volume dispensed should be 1/10 of a total milligram dose prescribed. Do not add other medications to the Ofirmev solution. Please see full prescribing information for Ofirmev, including complete boxed warning. For additional product information, visit ofirmev.com or contact Cadence Pharmaceuticals Incorporated at 1-877-647-2239. Ofirmev is a sterile, clear, colorless liquid and is supplied in a 100 milliliter single-use glass vial. Each milliliter of sterile solution contains 10 milligrams of acetaminophen. Therefore, one 100 milliliter vial contains 1,000 milligrams of acetaminophen. Always examine the vial contents before preparing or administering any dose. Do not use if you observe any particulate matter or discoloration. Ofirmev is preservative-free and is sensitive to oxygen. Therefore, it should be used within 6 hours of being opened. Ofirmev may be given as a single or repeated dose and should be administered only as a 15-minute intravenous infusion. No dosage adjustment is required when converting between Ofirmev and oral acetaminophen in adults and adolescents. Do not exceed the maximum daily limits of acetaminophen and consider all routes of administration, whether oral, rectal, or IV. Make sure to look for acetaminophen in combination with opioids or in cough and cold medicines on patient medication lists to avoid accidentally exceeding the recommended dose. Please see full prescribing information for Ofirmev, including complete boxed warning. For additional product information, visit ofirmev.com or contact Cadence Pharmaceuticals Incorporated at 1-877-647-2239. Ofirmev, acetaminophen, injection is indicated for the management of mild to moderate pain, the management of moderate to severe pain with adjunctive opioid analgesics, and the reduction of fever. Take care when prescribing, preparing, and administering Ofirmev injection to avoid dosing errors which could result in accidental overdose and death. Ofirmev contains acetaminophen. Acetaminophen has been associated with cases of acute liver failure, at times resulting in liver transplant and death. Most of the cases of liver injury were associated with the use of acetaminophen at doses that exceed the recommended maximum daily limits and often involve more than one acetaminophen-containing product. Ofirmev is contraindicated in patients with severe hepatic impairment, severe active liver disease, or with known hypersensitivity to acetaminophen or to any of the excipients in the formulation. Acetaminophen should be used with caution in patients with the following conditions: hepatic impairment or active hepatic disease, alcoholism, chronic malnutrition, severe hypovolemia, or severe renal impairment. Rarely, acetaminophen may cause serious skin reactions such as acute generalized xanthematous pustulosis, AGEP, Stevens-Johnson syndrome, SJS, and toxic epidermal necrolysis, TEN, which can be fatal. Discontinue Ofirmev immediately if symptoms associated with allergy or hypersensitivity occur, or at the first appearance of skin rash. Do not use in patients with acetaminophen allergy. The most common adverse reactions in patients treated with Ofirmev were nausea, vomiting, headache, and insomnia in adult patients, and nausea, vomiting, constipation, pruritus, agitation, and atelectasis in pediatric patients. The antipyretic effects of Ofirmev may mask fever in patients treated with post-surgical pain. Ofirmev is approved for use in patients 2 years of age or older. Do not exceed the recommended maximum daily dose of Ofirmev. Ofirmev should be administered only as a 15-minute infusion. To report suspected adverse reactions, contact Cadence Pharmaceuticals Incorporated at 1-877-647-2239 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see accompanying full prescribing information, including complete boxed warning.